The Progressive Liberal Party's task force on COVID-19 is weighing in on the state of the healthcare system and the impact COVID-19 is having on medical practitioners especially. Cleopatra Murphy reports that the team also had recommendations they believe the government could use.
With more than 200 healthcare workers, among them 96 doctors and 62 nurses under quarantine due to a 19 patient at the Princess Margaret Hospital, members of the Progressive Liberal Party's COVID-19 task force are expressing concern over a growing healthcare worker shortage. Co-chair of the task force, Dr. Melissa Evans, says there must be expanded testing for the virus, agreeing with other doctors who have expressed concern about the strain on healthcare.
That's quite worrisome for this pandemic, and so it is a valid concern that, these healthcare workers have been exposed potentially to confirmed cases, and that, of course, within itself, it puts a lot of pressure and stress on our already stressed healthcare system, and that alone is going to be something that we should be concerned about in an effort to try and combat such a pandemic such as this.
Also a co-chair on the task force, Senator the Honorable Dr. Michael Darville, says the task force previously recommended that governments utilize the expertise of Cuban doctors to lessen the strain on the healthcare system with so many healthcare professionals quarantined.
We feel that should be looked at again because most of these doctors have the expertise. Some of them have been trained with the Ebola virus in Africa, and so they can bring more expertise to the present team and to assist the government in particularly dealing with the pandemic in New Providence, Grand Bahama, and now we're beginning to see signs of potential community spread in the Bimini chain, mainly Cat Key and mainland Bimini.
The Minister of Health questioned about the country's ability to handle the COVID-19 pandemic and the possibility of bringing Cuban doctors, suggested outside help is not needed.
I don't believe that this is an issue of not being able to handle it. The index patient had symptoms that were inconsistent with the typical or usual, even the extended definition of COVID-19. The patient presented with neurological symptoms. The healthcare teams, many of them experienced, competent clinicians, did not make the call. The patient subsequently spiked a temperature and at that point was tested for COVID and determined to have COVID-19. We are doing an external review to look at the management of this patient and all of the patients from the time that the patient arrived at the hospital up to present.
To lessen the burden on healthcare workers, Evans advises Bahamians to stay at home if they do not need to go out.
There's now talk of our quarantine patients being in the community. That's by all means something that shouldn't be happening right now. We really need to put a taper on that and being able to track our quarantine and isolated patients and making sure that they are not in direct contact with the community. That's important right now.
Cleopatra Murphy, ZNS Network News.